I've been working out for a very long time, since I think 2006 or something like that. I got my triglycerides back, which was 600. So, something's really wrong with me. My LDL and cholesterol was also high at that time. So he put me on statins. So then I went the carnivore way. I lost quite a bunch of weight. I lost my heartburns and my GERD symptoms, my muscle soreness post-workouts. My libido went up. I've made them realize that the guidelines actually suck. I've reversed a few syndromes in my friends and families, diabetes, hypertension, hypothyroid, non-alcoholic fatty liver, infertility.
Where you've got a population in India who are perhaps the most plant-eating of almost any population of people.
And 17% of the world's diabetics are Indians. 70% of Indians are overweight at this moment. And I would say it's more than that, actually. Wherever you look around, you'll see obesity anywhere.
Boys and girls, ladies and gentlemen, super intelligent shades of the colour sky blue, pink, however you identify, that's fine with us. Today, my very special guest is Dr. Ankur Verma, all the way from India. So I thought what we'd do today is ask him all about that and, tell us how are things in India, how is the public health going there, what are the trends, how did you come across this particular crazy bunch of people eating this way? Give us the whole story, basically. Yeah, go for it.
Yeah, thank you so much, Bart, for having me on your channel. I got my triglycerides back 3 years back, which was 600, and it just opened my eyes as to, something's really wrong with me. I've been working out for a very long time, since I think 2006 or something like that. But then I used to eat everything possible because that's how the coaches train me in India. And that's what most of them do. You work out, you spend a lot of calories, so you get in a lot of calories. Anyway, so yeah, life was going good. Finished my emergency medicine training and, started working in the emergency department. And yeah, we learned how to save lives. We saved some, we lost some. And yeah, life was just moving on till, again, like I mentioned before, my triglycerides hit 600 and I was like, this is not right. I didn't know about triglyceride to HDL ratios at that time because, none of the lipid profiles show that. None of the doctors are trained in that. We're only trained to look at the total cholesterol, HDL, LDL, and the triglyceride levels and the VLDL if you really wanted to look at that. So I spoke to my cardiologist. Obviously, my LDL and cholesterol was also high at that time. So he put me on statins and told me to stop sugars, which was a good thing. And I knew that's one of the things that's contributed to my triglycerides being so high. So I cut off as much sugars as possible and went low carb basically because I used to like an Indian, I used to love my rice and my rotis. It was easier to cut off all rotis, but yeah, rice was still there and I was just having smaller quantities of rice. And I stopped red meats for a while because, cholesterol. So yeah, that was still the myth that I was living in at that time. But yeah, I started to cut down my weight. Obviously, I was calorie counting. So I was eating little lesser amounts of all macros, I guess. And then I read this book called Metabolical by Professor Robert Lustig, who's a pediatric endocrinologist in UCSF. And then it struck me as to how ignorant most of the doctors are regarding metabolic syndromes and nutrition as such. So I went down the rabbit hole. I started reading up more. I started reading up more papers. And 2 years later, last year, basically in April, somebody sent me Paul Saladino's reel when he was still a carnivore. And I was like, oh, this should not be a problem for me because I've always enjoyed my meats since about 2 years old. Since I was 2 years old, yeah, that's what my family tells me. So, if I would go for like family functions, they would have a whole chicken for me separately and a whole chicken for the rest of the family, So that's how much I love meats and chicken and stuff. So then I went the carnivore way and yeah, there was no looking back. I kept reading up quite a bit. I read up a little bit of my medical school books again, my first year biochemistry and physiology a little bit, and all the other nutrition articles that people actually go through, Obviously, there's no interventional per se research out there regarding nutrition, but then it did strike me as to what the species-specific diet was, and it really helped. I lost quite a bunch of weight. I lost my heartburns and my GERD symptoms, my muscle soreness post-workouts, my libido went up, and a few other symptoms that I had. I used to get acne quite frequently. I still get them a little bit. Could be the oxalate dumping that I might be having. Sometimes that happens. But yeah, the frequency went down. And then I started seeing this matrix, sort of like a matrix opened up and I started seeing these patterns in my own department because most of my patients that come in have metabolic syndromes, non-communicable chronic diseases, and they come in with the complications of these diseases or the complications of the medications that they might be on. And so we started doing a couple of research regarding non-alcoholic fatty liver and the association with the diet preferences that the patients are coming in with, and obviously a list of non-communicable diseases and the association with diet. And nobody knows better than you that, it's only going to be an association. But, so many people have taken out strong associations regarding meat. So I thought, why not, turn the tables and see what's happening in India. And we've got about 3,100 patients till now who've come in. So, and that's about 25 or 26% of the population coming into my ED. 25, 26% of the population has non-communicable diseases who've done the survey, who've actually entered the survey. There are others who said, we don't want to get into the survey. There are some that my team couldn't get surveys done from because they were really busy. There were some patients who were brought dead on arrival and we didn't want to bother the family asking them to do the survey. So the numbers would actually be more than that. Yeah, 62.4% as of a few hours back. 62.4% are pure vegetarians. The rest 30% are basically omnivores who eat meats once a week, once a month, twice a month. Not much. They're more plant-based omnivores, I would say. 85% don't drink alcohol. 72% don't smoke. Most of them have unprocessed foods because we have a lot of elderly population coming in. They don't eat too much of junk food. We were all actually listing down the NOVA list of foods also. And, they check that if they're having processed or unprocessed foods. There are some who take processed foods and then we ask them the frequencies also. There are some who eat in restaurants. We ask them the frequencies. Obviously, those frequencies are going to be a little difficult and it's going to be a little biased once we get it. But the question, the answer still remains that I'm still getting a strong association between a vegetarian diet preference with the non-communicable diseases. And we know that because they're deficient in a lot of macro and micronutrients, and they have abundance of anti-nutrients in them, anti-inflammatory products that are there. That's going to cause a lot of symptoms in them. I've started to ask my cardiologists and neurologists, why are you starting your patients on statins? Why have you checked the lipid profile yet? Not that you want to correct it, but at least have some evidence that, the patient's cholesterol is high. That's why you want to give statins. But, I've made them realize that the guidelines actually suck because you're starting these medications without even checking how the lipid profiles are. Mm-hmm. And then I took out retrospective data from a lot of my patients who've come into my department and, they've come in with strokes, we've thrombolized them, come in with heart attacks, and they've been stented and discharged. And the lipid profiles were either low normal or just about at the borderline of the high normal, Again, the statin. So, I've realized that, even as an emergency physician, if I'm saving lives at that moment and that's about it, I won't get the chance probably to save them again because they go back on these medications, but the root cause is still not addressed as to what the nutrition is, what the diet is. And, probably second time around, I might not be there. My team might not be there. You may not be able to be saved, and heart attack patients can go into congestive heart failure. And once they go into CHF, it only worsens. I'm just reading up that just reminds me because my mom-in-law just suffered from a CHF and I was talking to the family because our whole family is vegetarian. I've kept her sedated. I've put her on a Riles tube and I'm feeding only chicken soup. And I told the family that she's had enough vegetarian food her whole life. This is what it's done. And then I showed them a few research papers that are there, which have shown really strong association between low protein intake and higher mortality in CHF and high protein intake and lower mortality in CHF. That's my story. I've reversed a few syndromes in my friends and families, diabetes, hypertension, hypothyroid, non-alcoholic fatty liver, infertility. I've realized that this is where it is. I'm trying to link up metabolic syndromes and metabolic health with emergency medicine because we have the closest connect with the community. No other specialty deals with so many patients. We are the safety net. Even my team has started talking to all the patients as to what they eat, what their preferences are. And even if my team members are vegetarians, they tell the patients, you need to start eating meats. Because they're seeing it's because they're seeing the pattern themselves. They are quite motivated to change their diets. It's going to take some time, but at least they've started to talk to the patients regarding their own nutrition.
So how is that viewed by the establishment, what you're doing there? Because obviously you'd be out of line with what everyone else is saying there. How does that play out? It's
a good thing that I'm in emergency medicine. So I don't discharge patients on medications, most of them. Most of them get admitted to different specialties and they're the ones who are discharging the patients and they become their regular follow-ups. I just tell them, this is what's happening with you. Nobody else in this hospital is going to tell you about your nutrition and your diet. So once you're discharged, you're free to come back to me and talk about it. Don't stop your medications, change your diet, follow up with your doctor. He'll be forced to stop your medications once you're done. So not many people actually do come back, but that's a start. But then at least in my department, I've banned all sugars and processed foods. So, even if somebody's ordering coffee, be it a patient or an attendant or a staff or a doctor or a nurse, the barista knows that they can't get sugars down with the coffee. And if somebody asks for sugar, I'm called upon.
Fascist.
Yeah.
Love it.
So that starts off a conversation with the patient in that end. I'm like, you're already diabetic. Why do you want sugars?
Right.
And the ones who are not diabetic, I'm like, do you want to become a diabetic? And this is the reason why I've stopped sugars in my department. And then, it sparks off a conversation. And, some of them do understand, some of them don't. And even my FNB has been ordered that, any long-standing patients in my ED should not be provided with any of the processed fruit juices because that's a common practice in a lot of hospitals. So at least in my department, it's not there. So
Awesome.
yeah, I mean, somebody has to start somewhere.
Good. Yes. All right. So you're not getting too much pushback from management. You're not being told to do anything different. That's good.
Yeah, not at the moment. Yeah.
That at least you get the leeway to say, well, look, this is how I want to practice. This is what makes sense. So that's good. That's encouraging. What's not encouraging is the statistics that you've kind of outlined there. So let's get into that just a bit more if we can.
Yeah.
Where you've got a population in India who are perhaps the most plant-eating, shall we say, of almost any population of people, the most vegetarians, I guess. And you also have this frankly terrifying rate of, diabetes type 2, obesiogenesis, heart disease, congestive heart failure, and cancers as well.
Yeah, a lot.
Yeah. So how is this message not getting through to the Indian people? What are they being told that's leading them down this garden path?
Well, the ICMR, the Indian Council of Medical Research, came out with the food plate, which is the same as the American food pyramid, and it's quite surprising because people eat that. There's nothing different in that. The people in India actually eat that because it promotes cereals and grains and fruits and vegetables, and the Indians love that. And 17% of the world's diabetics are Indians. 70% of Indians are overweight at this moment. And I would say it's more than that, actually. Wherever you look around, you'll see obesity anywhere. Yeah, a lot of pot bellies walking around, and I'm pretty sure most of them are not even diagnosed with pre-diabetes or diabetes yet, and they'll be walking around like taking time bombs. But yeah, like I mentioned, most of the population is vegetarian or plant-based omnivores, and it's not just about processed junk foods. Yes, that's also quite common in India, but not as much as the West. But yeah, the younger generations are suffering because of the processed junk foods. But even the middle-aged people, the young adults, and the geriatric populations, they have standard Indian carbohydrate-loaded vegetarian diet. You go to south of India, the breakfast starts with what we call idlis and dosas and stuff, which is made of refined flour. You go to the north, there's something called chole bhature and pav bhaji, which is all carbs, which is all like basically chickpeas and again refined flour. In the west, you have rice-based breakfast. It's called poha. In the east, you have these puris and luchis. Again, they're made of refined flours and potatoes. So yeah, I mean that's like the breakfast that people usually have in India. Parathas, I don't know if you've heard of parathas, but they're basically stuffed with a lot of potatoes and stuff, and fried on tawa. We call it like a flat pan. If so people say that
carbs
Indians,
and seed oils.
Yeah.
Wow.
But again, in my data, it's quite surprising because most of the population uses ghee. They're still using ghee and mustard oil more than the refined oils. But clearly, that's not being protective because they're still eating a lot of carbohydrates.
Yeah.
A lot. Yeah.
So my understanding is that the Indian population has the largest middle class working population of pretty much any modern nation. So if you've got 70% of those people who are ticking time bombs in terms of their health, at some point you've got a major national disaster on your hands there, haven't you?
Yeah, absolutely. Yeah. And now we have kids coming in with non-alcoholic fatty liver. We've got kids with pre-diabetes. And this is not just urban sectors, this is even in the rural areas. I mean, there was a study which was published again in the Lancet, because I'm just quoting them because people love to quote the Lancet, and where they compared urban and the rural sectors. Maybe I think there was 1,000 patients each, something like that, and 50% of the urban sector had diabetes and 47% the rural ones had diabetes. I don't think that's a major difference between the two. A lot of people would have thought the rural areas don't get diabetes and heart disease, but they do because they also eat a lot of carbohydrates.
All right. Well, how long have you been involved in social media, influencing people that way?
I don't think I've influenced too many people yet. I'm just trying to inspire them with my story and others' stories. But yeah, I made my Instagram public in, I think, Jan of this year. I've been doing my podcast for the past 3 years. Once I understood metabolic health and emergency medicine can go together, Yeah, so I started delving into that since January again. So earlier on my podcast, it was more about emergency medicine, and yes, there was a little stuff about nutrition and fitness and stuff. But then getting guests like you on my podcast, I started in January, and there's no looking back. I mean, I'm
Awesome.
trying my best to raise as much awareness as possible in India.
Cool. I mean, the reason I ask, obviously, is because, when you think about it, all right, educating people about health and nutrition on social media, and also, I presume, 60 to 80 hours a week working in the ED, does there get to a point where you think, I'm wasting my time here? I mean, I know you're there to save people, and we get that, and, someone's got to do that. But at some point, you go like, when does this stop?
Yeah, I've had thoughts. At this moment, I still need like a regular income coming in. So I don't mind saving lives at the moment. But yeah, there will come a time when, once this movement becomes bigger in India, probably I'll have to turn around, or maybe, I don't know, somehow mix the two of them up, maybe get support from the institute if they do. And if they're okay with, healing patients and curing patients forever so that they don't come back to the hospitals and the support.
Pharmaceutical companies don't like that, though.
Yeah,
at all.
They don't. I mean, yeah. I mean, why should they? I mean, they're
exactly.
a profit-making company, yeah.
Yeah.
They just want to sell more medications, yeah.
That's it. And I guess that the Indian population there are sitting ducks in terms of wringing out every cent out of the Indian population in terms of these drugs that will only ever mask symptomology.
Yeah, Indians have this luxury of, I was talking to a couple of doctors a little while back on my podcast, Roshni, and I told her that Indians have this luxury of getting 7 different prescriptions from 7 different doctors over a week very easily. And that's how rampant medications are in India. And you're not a real doctor if you don't prescribe statins and antibiotics, and you'll get them over the counters anyway. Yeah, people sneeze away and they go and take an azithromycin.
Right.
They have one Lucy and they start off with ciprofloxacin and tenedazole because they're so used to it, because doctors have also prescribed it like that. You have a couple of loose motions, they start you on antibiotics. So then the patient's saying, okay, fine. I mean, the doctor's giving me that. Might as well not give the money to the doctor for a consult. I can just go to the pharmacy and pick up a Ciplox TZ and do a whole course myself. And then we see that there's so many young patients coming in with infections who actually require antibiotics, but they've all become resistant, So yeah, that's another major problem in India.
All right, so tell us about this podcast. Where do we find it? How do we follow what you're doing? How do we support what you're doing? Bit of cross-pollination.
Yeah, sure. Thanks. I mean, this is called the Desi EM Project, DESI. Desi is basically a slang for Indians in the US. So we call each other Desis, over there. So it's called the Desi EM. EM stands for Emergency Medicine Project. It's available on Spotify, Apple, and Google Podcasts. Yeah, I mean, whenever I come out with a new episode, I make a couple of reels and I promote that on my Instagram. You've seen yours yourself. Yeah, and my Instagram handle is thecarnivore.ep. EP stands for emergency physician. So yeah, I mean, those two are the only ones that I'm doing right now, just taking it easy. A lot of people have told me to get into YouTube. I'm like, yeah, I need more help with that.
Yeah, and of course, YouTube is a whole different kettle of fish as well, because of the quite rampant control that the YouTube folks exert over whose visibility is good, bad, or indifferent based on how well they follow the mold of what the YouTube folks want people to be saying and not saying, shall we say. Yeah. It's the biggest one. It's the one that you can probably get yourself in front of the most people in terms of long form stuff, longer than 10-minute videos or something like that. But yeah, it does definitely have its issues, does the old YouTube, in terms of that. I went the other way around. I started with YouTube only, and then I started a few other social media things on the side, which will probably at some point end up being my biggest audiences, because they kind of tend to grow a bit more organically, whereas every single sub on YouTube is hard fought and hard earned and all of that, because YouTube just don't want me to succeed, basically, is what I'm telling you. So there is that. All right. Okay. So I guess backpedaling a bit, going to the patient-facing meeting, you're faced with this patient who is probably obese, type 2 diabetic, and all the sequelae of that's going on. They've come to the ED because something acute has occurred out of all of that. How are you handling that? How are you getting the message across to that patient that the problem is what you're eating here?
Yeah, so first of all, my survey actually helps, because, one of my residents goes up and, asks them like about 32 questions, and they give all the answers. And then I call the family over and I'm like, this guy's been a vegetarian all their life. Have you thought about eating meats? And they're like, why?
What?
And And they're like, but what about cholesterol? I'm like, yeah, I'm sure that you have questions. Are you curious to know more?
Right.
And some of them are.
Mm.
So then I take them to my room and I tell them to ask me questions first.
Right. Good. Yeah. Okay.
Regarding meats and eggs or whatever, whatever they want to ask. And then I just take a paper. I speak about macros and micros, essentials, non-essentials. Where do you get these? What are the myths? Gluconeogenesis a little bit,
Yeah.
Some of them do understand, and some of them do understand, yes, this is what our ancestors used to eat, and things like that, light bulb moments and all. I let them lead the discussion.
Mm.
And once I'm done with like a 2-page back and front writing and drawing and all of that, I just give it to them that, don't believe what I'm saying. You can go back, find any of this on the internet, because you guys are probably better at Googling than doctors, and you'll find everything that I've spoken about. This is my podcast. This is my Instagram. You can follow it. You can listen to a lot of other experts. It's not just me. There are a lot of experts who come onto my podcast and they chat and we have a conversation. And you'll understand that it's not just me who's talking about this. There's a lot of doctors, nutrition coaches, scientists who are speaking the same language. And that makes it a little easier for me to explain to them. I don't know how many of them are going to follow, but maybe somebody gets inspired somewhere, takes it up, does something, spreads the news, spreads the knowledge, spreads the awareness that, this is something that's happening in India, So yeah, let's see. I mean, that's how I approach it, basically.
Awesome. Sounds good. So yeah, I mean, I guess it's like anywhere. You've got the prevalent problem of dealing with the societal really brainwashing, the programming from a very young age. So I guess you get cholesterol though, red meat and cancer though, and fiber though, vitamin C though. It would be those 4, wouldn't it?
No, I don't get vitamin C.
Okay, good. Yeah. So it's just the 3.
Yeah.
All
So they're not very aware about pros and cons of vitamin C, unlike the Western civilization, I guess.
Okay.
But yeah, mostly they talk about cholesterol and then proteins. These are the 2 things they talk about. And the myth that lentils and legumes have a lot of proteins. And I tell them, just Google it. I'm just like, just Google 100 grams of lentils, your favorite one, and tell me what you see. So they see that it's got about 15 grams or 20 grams of protein, but 3 times that of carbohydrates, right?
Yeah.
So first you're getting almost 60 grams of carbohydrates and 100 grams. And then these proteins are non-essential amino acids. And then they're covered by other proteins, which are not going to let you absorb whatever little bit that they have. And in India, we get a lot of fortified lentils. And they know that. So why are they fortified with chemicals if they actually have natural proteins in them? So that's like a light bulb moment that they have. Again, yeah. So those are the type of conversations we need to have more regularly in India, at least.
Good. Well, I'm glad that these discussions are happening at the clinical level. I'm glad that you're making an impact, and long may it continue. I do think that the most efficient way of getting the message to the most number of people possible, however, is not now as for dollars in the clinical setting. It's going to be getting more Indian influencers involved, getting more of you singing off the same song sheet, more of you educating your fellow countrymen about where it's at. And by no means are the rest of us over here in the more westernized world sitting on our laurels saying we've got this one sorted. No, we have the same battles you guys do. We have the same ridiculous brainwashing that you guys have got as well. So I think it's a great thing for us to work together and to cross-pollinate. Yeah. And to get our song sheet in order, I guess, so that we're all singing the same song. So there we go. Basically, absolute pleasure talking to you. It's always good to talk to clinicians wherever they may be in the world about what's going on in their part of the world. Always good to cross-pollinate. Of course, I would suggest that all my people should rush across and follow your podcast and your Instagrams and all of that stuff that you were talking about. And it'd be great to have you on the program again in a bit to see how things are developing.
Yeah, absolutely. Thank you so much for having me, Bart.
Awesome.
It's been a pleasure. Yeah.
Yep. All right.
Bye.
Cool.